Prescribing in older people. Most older people are on regular medication. Pharmacokinetic and pharmacodynamic are different in this age group. Older people are much more likely to suffer from the side effect of drugs, pharmacy, and the problems with concordance are particular issue in geriatric medicine. Drug trials not to include people over the age of 80. Two-thirds of people over the age of 60 are taking regular medication, and over half of those with repeat prescription are taking more than 4 drugs. People in care home are even more likely to be taking several regular medication. Adverse drug reaction account for up to 17% of hospital admission. Pharmacokinetic and pharmacodynamic in older age. Pharmacokinetic refer to what the body does to a drug. Pharmacodynamic refer to what a drug does to the body. Pharmacokinetic differences, age-related changes lead to differences in absorption, distribution, metabolism, elimination of drugs. While some of these differences are not clinically significant, some are. There is a reduced volume of distribution for many drugs because of reduced total body water and increase in the percentage of body weight as fat. As a result, those requirements are less than in younger people. For example, digoxin is a water-soluble drug and lower loading doses may be required. Diazepam is a lipid-soluble drug and the relative increase in body fat may lead to accumulation causing toxicity. Liver metabolism is reduced, leading to slower drug inactivation. Reduced liver blood flow is made worse by cardiac failure, potentially leading to increased drug concentration, although this is rarely of clinical significance. However, care should be taken when prescribing drugs that are metabolized in liver and have a narrow therapeutic index. Warfarin, tiophylline, phenytoin, plasma level of these drugs should be monitored. Perhaps the most clinically significant difference is that renal blood flow and mass reduce significantly with age, leading to reduction in clearance of many drugs, especially water-soluble ones. Because of the less muscle mass, the creatinine can remain within the quoted normal range in older people despite a significantly impaired glomerular filtration rate occur. Doses of some commonly prescribing drugs should be reduced to account for reduced renal function as measured by glomerular filtrate rate, GFR. Example are ciprofloxacin, gentamicin, digoxin, and lithium. Pharmacodynamic differences. There is an increased sensitivity to drug in general, and lower doses are often required compared to younger adults, primarily due to changes in drug receptor and impaired homeostatic mechanisms. For example, patients started on treatment for hypertension may develop dizziness due to reduced baroreceptor sensitivity causing posture hypotension. Adverse drug reactions. Adverse drug reactions are a common reason for hospital admission. Around 80% of adverse drug reactions are dose-related, predictable, and potentially preventable. Other ADR as adverse drug reaction may be allergic or idiosyncratic, unpredictable. However, adverse drug reaction often present in older patients, non-specifically with confusion or falls. Older people are more likely to have diseases that result in disease-drug interactions. Every prescriber should consider this before prescribing for an older person. There are a number of problematic drugs in older people prescribed medication that commonly cause side effects. Polypharmacy and the drug interactions. Polypharmacy is when a patient is taking a large number of different prescribed medication, some of which may be required, others not. Here some example of drugs and disease in older age and the drug and the potential effect. dementia, benzodiazepine, worsening confusion, Parkinson's disease, antimuscarinic, worsening the symptoms, seizure, antibiotic, reduce seizure, threshold, glaucoma, antimuscarinic, beta blocker, worsening the glaucoma, hypertension, non-steroidal anti-inflammatory, hypertension, cause hypertension, falls, cardiac conduction disorders, beta blocker, digoxin, cause bradycardia and heart block, peripheral arterial disease, beta blocker, intermittent calcification, upper gastrointestinal hemorrhage, peptic ulcer, non-steroidal upper gastrointestinal hemorrhage, hypokalemia, digoxin, cardiac arrhythmia. Here some common problem and drug that can cause them. Confusion drug causing confusion and affect memory, antipsychotic, benzodiazepine, antimuscarinic, opioid analgesic drug with narrow therapeutic windows like digoxin, lithium, phenytoin, theophylline, warfarin, drug with a long half-life, long-acting benzodiazepine, fluoxetine, glibenclamide, drugs that can cause hypothermia, antipsychotic, tricyclic antidepressant, drugs that cause Parkinson and movement disorders, metoclopramide, antipsychotic, stimulant, drugs that can cause bleeding, non-steroidal anti-inflammatory, warfarin, drugs that predispose to fall, antipsychotic, sedatives, antihypertensive, diuretic, antidepressant. Reason for polypharmacy in older people: several chronic diseases, processes require specific drug treatment: ischemic heart disease, hypertension, stroke, atrial fibrillation, depression, more than one physician involved in the medical care for different diseases, admission to residential or nursing home, failure to review medication and repeat prescription, failure to discontinue unnecessary medication, failure of physician to recognize poor therapeutic response as non-compliance, application of evidence-based medicine appropriate and inappropriate. Taking a large number of different drugs is linked to adverse drug reaction, increased risk of hospital admission, non-compliance, and increased cost to the national health service. Drug-drug interaction become more likely with increasing number of medications, herbal remedies, and food can also interact with prescribing medication. A patient on warfarin for atrial fibrillation may develop bleeding after starting ginkgo biloba, a herbal medicine that inhibit platelet aggregation. A patient prescribed phenidopine for hypertension may develop profound dizziness after drinking grapefruit juice, which increase drug levels. Concordance. Concordance refers to the agreement between prescriber and the patient about the goal of treatment and how such goal will be reached that are easy to use. Compliance or adherence is the extent to which a person follows the prescriber advice and drug regime. Both concordance and compliance are particularly relevant to older people, although age itself is not a predicator of non-compliance. Concordance is good when there is a clear communication, understanding, and agreement, and a drug regime that is easy to follow with packaging, label, and delivery systems. Polypharmacy and the drug-drug interaction. And then here is an example. An 86-year-old man with atrial fibrillation, heart failure, renal impairment, and the benign prostatic hypertrophy present with dysuria. He has had several falls previously. He is prescribed ciprofloxacin based on previous urine sensitivity. Opportunity to review this medication. He takes 12 drugs regularly, which are on repeat prescription include alphazocine, atenolol, amidodrone, brinodoprid, furazimide, warfarin. This is the active principle, and the name in the pharmacy may be different from country to country. Is one several medications that cause falls. Warfarin therapy may now be unsafe because of his ciprofloxacin interact with warfarin and increase the risk of bleeding. Information to give patient to improve compliance about specific medicine, name of the drug, the purpose of the drug, dose or strength, when to take in relation to food or other medicine, common side effect, how long to take the medicine, other warning, general information about medicine, don't take someone else's tablet, keep taking medicine at the prescribed dose unless otherwise directed, don't transfer medicine into an inappropriate container, avoid taking your medicine in the dark, drug-related problems that may be identified at medication review. A medical condition is present that requires drug therapy, but patient is not receiving any. The patient has a medical condition for which the wrong drug is being taken. Too little or too much of the correct drug is being taken, resulting from a doctor. The patient is suffering from an adverse drug reaction. The patient has a problem, drug food or drug disease interaction. The patient is taking a drug for which there is no valid indication. Review all medicine regularly. There is sometimes a reluctance to discontinue drug if the patient has been on them for a long time, if they were prescribed by another specialist. However, due to age-related changes, some drugs that were once beneficial may now be unnecessary or even causing harm. Assess the patient. A good history, examination, and any appropriate tests are important in making an accurate diagnosis. A drug history should include not just prescribed medication, but any borrowed medication and over-the-counter drugs. Allergies should be clarified, as many patients are intolerant rather than truly allergic to drugs. Consideration should be given to the factors that affect compliance. Think about non-pharmacological treatment. Think about the risk as well as the benefit. Start with a lower dose for most drugs. Think about the route of administration. Provide information and education. Here, prescribing an example of prescribing in the older patient. The medical condition arthritis, non-steroidal anti-inflammatory is prescribed. Hypertension, calcium blocker, ankle swelling, diuretic, gout. This is prescribing cascade. Failure to recognize the side effect of commonly prescribed drug can lead to prescribing cascade, resulting in unnecessary drug cost and reduced quality of life for an individual. 78-year-old lady is prescribed on non-steroidal anti-inflammatory drug. Side effect of this drug: she is put on calcium blocker for hypertension, then to follow ankle swelling. A side effect of this drug: she is put on a diuretic for ankle swelling, is put on allopurinol for gout, and then develop all of other complications listed, posture hypotension, or as a result of calcium blocker and diuretic, leading to restricted activity and loss of confidence and indigestion, which is a side effect of non-steroidal anti-inflammatory. This is a vicious cycle of the drug and its side effect, and we treat the side effect, and the cycle is completing again and again. Thank you.